Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, my name is Dianti EA. I'm lecturer in Informatics Department Universitas Muhammadiyah Bandung. In this occasion, on behalf of the team, I would like to deliver our online presentation on the first Paris-Van Java International Seminar on Computer, Science, Engineering and Technology or PVJ-IS ComSET.
Our research paper title is Usability, User Experience, and Self-Determination Theory Motivation Analysis of Pregnancy Application for Antenatal Care Support Information System Requirements. Based on Indonesia statistic data, estimated that Indonesia MMR in 2015 was 305 per 100,000 live births. And one target of the Sustainable Development Goals (SDGs) in 2030 is to reduce the global maternal mortality rate in 70 per 100,000, which means that due complication for pregnancy or childbirth should less than 70 deaths per 100,000. And pregnancy is a unique period with various physical and psychological change that affect women's life. Therefore, a good pregnancy support application and the system should be personal to each woman. And pregnant women can use mobile or smartphone application and social media to promote their pregnancy. The purpose is to improve the quality of existing application and system by understanding response and satisfaction about the system and psychological needs of pregnant women as user and to fulfill the requirement of the proposed antenatal care system called Xena. The proposal of Xena system done by compare existing pregnancy application and then integrated modules that had good usability and self-determination theory aspect to design better antenatal care system. In this research, we conduct 3 surveys and 1 usability test to women aged 20 to 37 years old who had been pregnant and user of the pregnant-related application as the sample, with parameter in the ease of use of the application, how easily user find the information they need, how good user can understand the content, how comfortable the user is using the application, and how personal pregnancy health awareness after the use of the pregnancy-related application. The survey are, firstly, survey to obtain information about the behavior and needs of pregnant women, which was distributed to 35 women. And secondly, a survey to gather information about pregnant women's need to pregnancy application based on usability and self-determination theory aspect, which distributed to 50 women. And thirdly, usability testing, use act testing, and SDT motivation analysis to conduct on 12 women have been used the Infobunda and Pregnancy Plus app, and finally expert judgment by 3 people, midwife, obstetrician, and IT practitioner. User experience consists of 4 elements. They are usability, valuable, adaptability, and desirability. And some of the specifications to achieve good usability are learnability, efficiency, memorability, error, and satisfaction, with the 3 basic psychological needs that can affect self-determination was competence, relatedness, and autonomy. Stage carried out in this study are Stage 1, determine participant. Stage 2, conduct user requirement and behavior survey. Stage 3, conduct user requirement survey based on usability and self-determination theory from existing pregnancy application. Stage 4, conduct interview to validate usability, user experience, and self-determination theory aspect on 2 existing pregnancy applications. Stage 5, conduct expert judgment survey, and Stage 6, analysis responses of survey, and Stage 7, design recommendation for improvement existing pregnancy-related and proposing an antenatal care support system. In this research, we found 4 results. They are user requirement and behavior, user requirement with usability and self-determination aspect, validation from expert judgment, and lastly, testing with usability, user experience, and SDT aspect. We found that 42% of respondents prefer to get pregnancy-related information through health worker, such as doctor, midwife, or nurse. And 24.6% participant from computer or smartphone. And Rest is through book media, people around, and community-based maternal and child health service. Example, Posyandu, Polindes, and Poskesdes. And all women in the present study had used social media to look for pregnancy-related information, with 40% social media use such as the blog, 23% wiki, and 60% chatting application, 40.3% use Facebook, and only 2.6% use websites same as Instagram. And the problem are often found in the use of social media are 31.7 are because the intervention of advertisement in the application, and 30% information regarding pregnancy that cannot be trusted, and 16.7% of the information presented is not relevant. And in application use, 49% of participants use application pregnancy, with 29.4% of participants use the application to get information, and 23.5% to get latest information about fetus development, and 11.7% to attend online forum. And from the study, there were 51% who did not use the application for various reasons. Among them is 33.3% had not installed the application, 16.7% of the information presented was not trusted and felt unnecessary, and 11.1% due to gadget limitation, memory, and did not know of pregnancy application, and 5.6% with other reasons. The problems that are usually encountered when using application, 50.2%. Participants agree that information present is incomplete, and 27.1% large memory, 18% of information is incomprehensible. And with this is user requirement, with expectation of pregnant woman as user of an application is 47.9% complete information, and 29.8% with lightweight application, and 19% with attractive user interface. Some additional function or feature needed by pregnant women are 31.9% with chatting feature, and 24% with nutritional information, 23.4% with drug or supplement information, and 15.1% reminder for antenatal care schedule. Usability and self-determination value of pregnancy application requirement, with this study using a Likert scale that turned into average internal in the value of respondents' response, which is 1 to 1.79 is are strongly disagree. 1.80 to 0.59 are disagree, and 2.60 to 3.39 are undecided, and 3.40 to 4.19 are agree, and 4.20 to 5 are strongly agree. With the based on learnability requirement regarding ease of understanding and using the application, an average value is 4.41, and the aspect of efficiency, that data application efficiency results are found with a value 4.31, and in the aspect of memorability regarding easy to remember as a reminder with a result 4.60, and the aspect of error with the handling, if there are error with the value 2.21, that means disagree. And the aspect of satisfaction with question regarding safety, comfort, and satisfaction in the use the F1 a value 4.57. This is the higher value among others. And furthermore, aspect of SDT are competence, relatedness, and autonomy. Competent aspect about competency information regarding the availability of a pregnancy journal of diary feature worth 4.47, and relatedness about the feature of the forum and chart to share information with other pregnant women and health worker value 4.37, and autonomy but ask questions about information for independently at any time and pregnancy advisory with 4.41, and all aspects on SDT are value above interval of 4.205. This is that mean which mean all they strongly agree. This is strongly agree in SDT. And based on the results of interviews conducted with experts who have three roles: a mother, health practitioner, and IT and application user. It is products that the average percentage of total justification is 90%, which means that they strongly agree so that it can be stated that pregnancy application is a matter which can help pregnant women to do health care, and monitoring on the health of their pregnancy can also help medical staff in conveying pregnancy information to pregnant women. And the object of testing conducted in this study is not the design of the antenatal care information system, but rather the testing of aspects of usability, user experience, and self-determination in existing apps to propose a better antenatal care system with comparative pregnancy app are Pregnancy Plus and Infobunda application. With the average interval of response value is divided into three: disagree, neutral, undecided, and agree. And in the Pregnancy Plus application, the usability and user experience aspect have a value of 1.70, which means that the respondent judge undecided or neutral that Pregnancy Plus application fulfill aspect of good usability, whereas from the interpretation of percentage, it is known that 60 of respondent improvement disagree if this app has aspects that have good in rate, that is Pregnancy Plus app still need improvement in its usability aspect. In the aspect of SDT, the assessment is 2. The average score is entered at an undecided interval or neutral interval, and respondent assess neutral that the application of Pregnancy Plus has met the aspect of good SDT. However, based on the interpretation of percentage, it is known that 50% of respondents disagree and 50% agree if it is set as the appropriate SDT aspect to pregnant women. The aspect of usability is 2.5, 2.35. Value means that respondents agree that Infobunda apps has good aspect of usability and user experience, and 63.33% of respondents agree that Infobunda has good in UX aspect, while in SDT aspect the value was 2.44. This score is include the interval or agree agree. That means the respondent agree that Infobunda application has fulfilled good SDT aspect, and based on the percentage, 72.22% of respondent rate agree this app has basic needs according to aspect learnability, autonomy, satisfaction, efficiency, and relatedness of pregnant women. This is comparison between Pregnancy Plus with Infobunda of usability, UX, and SDT aspect. Based on the comparison result, it can be seen that the SDT aspect, the pregnancy application, is higher in competence aspect. In this app, it consider to present information on pregnancy and childbirth, This is more relevant and interesting because the illustration of fetal development, and while Infobunda application has the highest in UX, this is value in the aspect of satisfaction, and the user feels comfortable and satisfied in using Infobunda application. Zena's component based on an extract of pregnancy and Infobunda aspect in the aspect of error and satisfaction are considered have equality. However, in other aspect, Infobunda is higher, and following Zena component are obtained from the result of complementing the pregnancy plus and Infobunda application. This is component of Zena adaptation from the higher aspect of existing pregnancy app. And this with aspect competence, this is adoption from pregnancy plus. This is learnability, efficiency, memorability, adaptation for Infobunda aspect, error, satisfaction, this with pregnancy plus aspect adoption, and error, relativeness, and autonomy also with adaptation from Infobunda. With its feature in Zena is competence to show fetal development with interesting illustration and attractive color and image. And in learnability aspect, Zena using bahasa Indonesia and simpler display. And efficiency aspect is to assessing feature use and smaller file size because the user have a limited memory. And with memorability aspect, Zena have simpler user interface, and error aspect have handling of error and display pregnancy information that is quite satisfying and practical, easily and complete feature in desirability aspect. And in relativeness aspect, pregnant woman for have pregnant forum with Q&A with medical personnel. And with autonomy aspect, show fetal information every week, and fertility calculator is from adoption from Infobunda aspect. Finally, the conclusion in this research is: first, usability needs has an average value 4.002, which means that respondents agree that want to use a pregnancy apps that easy, efficient, easy to remember, can handle mistake, and can provide satisfaction to its user. And second, average value of SDT motivation need is 4.41. Then respondents strongly agree on the existence of SDT aspect in the pregnancy application. This proof that basic human psychological needs such as competence, connectedness, and independence are important aspects to an antenatal care support system. And third, based on the analysis of UX and SDT, a pregnancy application system design that meets the aspect of UX and SDT is proposed by completing and integrating the previous use app to produce an application that encompasses elements of experience and complete human need called the Zena Antenatal Care Support Information System. And fourth, from the result of the study note that the usability and user experience satisfaction aspect from the Infobunda application and SDT competence aspect from Pregnancy Plus application will be integrated into a component of the Zena antenatal care support system design. So this is the end of the presentation. Thank you very much.